Hi, this is Brian Kim. I'm going to share with you case number 78 in the best way to do cataract surgery series. This is a very dense lens which we call a Catarock, and you're going to see double chop, cross chop, mechanical fracturing techniques, and systematic lens disassembly utilizing reduced ultrasonic energy using mechanical fracturing forces to carefully disassemble the lens in a very careful and methodical manner. So here's the dense lens. You can see not much of a red reflex, kind of a brown colored lens. Using a cotton tip to turn the eye so I can make my corneal mark. I'm using a diamond blade to make my paracentesis incision, first on the right side and then the left side. Make sure the incision is parallel to the iris plane, which creates a nice horizontal shelf, which will allow me to achieve a self-sealing incision. I'm injecting some intracameral lidocaine and then some intracameral epinephrine. Anytime you have a really dense lens, you want to really get a nice sized pupil whenever possible. And I'm injecting some intracameral air and then now some trypan blue to paint the anterior capsule surface. Whenever there's a dense lens like this, it pays to put trypan blue in just in case you have trouble finding the rhexis. In case you have an anterior capsule tear, you'll be able to more easily identify that. And also, if you have to put iris hooks in, you'll be able to identify the rhexis edge better. So go ahead and inject some dispersive viscoelastic to fill the anterior chamber. And this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then enter. I'm pushing some more viscoelastic to fill the chamber even more here. And then this is a puncture style rhexis. I'm going to use the forceps to puncture the central capsule, creating a flap on the left side going around circumferentially. And you want to make a larger size rhexis rather than a smaller size rhexis when you're dealing with these very dense lenses. All right, so now we finish off the rhexis. Burp some viscoelastic out of the eye. I'm grabbing that little tag of capsule. This is the capsular fornix hydrodissection technique. I place a cannula out underneath the rhexis edge, contra-incisionally, point the tip down, push. I don't really see a wave because it's such a dense lens, but I see the lens rise. I decompress on the left side. I turn the cannula to the right, and you can see the lens spun pretty nicely there. Irrigate the surface of the eye, making sure my sleeve is of the appropriate length from the tip. In this dense lens, I like to have the sleeve a little bit more retracted. Lift the incision with the chopper, go in with irrigation off to minimize Descemet's trauma. Try to remove any surface epinuclear material if possible. Usually it's hard to remove that in a very, very dense lens. Place the chopper underneath the rhexis edge very carefully, turning the fingertip vertically sub-incisionally, bringing both instruments together very slowly and carefully, crushing and bisecting the lens completely in half, just very carefully spreading my instruments from one another, making sure the lens is completely bisected here. Going into the sub-incisional area with the chopper and just stretching and stretching, making sure the posterior aspect gets separated. Place the chopper around the right heminucleus, pulling it centrally towards the phaco tip. You can feel the thickness and the resistance of this very dense lens as I pull it towards the phaco tip. I'm able to divide it, and then you can see it's separating pretty nicely there, and that's the cross chop. I'm going after the first quadrant, which looks like the most free piece there, placing the chopper around the lens piece, pulling it towards the phaco tip dividing that first quadrant in half, placing the chopper around one of the pieces there, using a little bit of vacuum as well as mechanical force to pull that lens piece up with the chopper, crushing it in half, separating it again using mechanical forces. Now I'm going to try to go after it with a little bit of vacuum, pulling one of the pieces up, emulsifying the piece. There's a free piece there. There's another one right there. So I grab it with some vacuum, pull it up, and emulsify it. This is that fragment from the first quadrant. Lifting it with some vacuum, crushing it with the chopper and a fingertip, sandwiching it with mechanical forces, and then emulsifying the pieces there. So you can see the second quadrant still attached a little bit. And so I'm just rotating the lens very carefully. Thankfully, the lens is spinning pretty easily. I'm placing the chopper around the lens to separate that second quadrant from the rest of the lens there. So again, I'm just getting around it and then just spreading, separating the two instruments to separate the two lens pieces. Again, because it's such a thick lens, you can have pretty deep posterior attachments there. Get the instruments around that lens piece, crushing it and dividing that second quadrant now, using a little bit of vacuum to hold the lens piece, and then emulsify the lens piece. Okay, so that's the second quadrant, which is gone now. I'm going to rotate the second heminucleus in front of me, place the chopper around the lens piece, making sure I'm definitely underneath the rexus edge, placing the fingertip deep. Yeah, I'm not quite around it, so I go again, making sure I can feel the lens between my instruments. Now I do. Now I bring them together. I'm crushing the lens now, and then I start to spread my instruments. And by doing so very carefully, I'm able to separate those deep adhesions. Placing the chopper around the lens once again, keeping the fingertip deep, bringing the instruments together, feeling the thickness and the girth of the lens, and then crushing it with mechanical forces. Again, carefully spreading the instruments, which will cause separation of the lens pieces from one another. So I have three little pieces here now, getting the chopper around that other piece there, crushing it and dividing it. I take the chopper out and I'm going to push some more viscoelastic to coat the corneal endothelium at this point. I want these patients to have clear corneas post-op day one whenever I can. So I'm really generous about viscoelastic, and I'm also very stingy with the ultrasonic energy. So I get my fingertip right up to the tip, use the vacuum to grasp it, lift it up out of the bag, use the vacuum to control the piece, and then crush it between the chopper and the fingertip, and then emulsify the lens piece. Grasping that piece with some vacuum, lifting it up, sandwiching it between the chopper and the fingertip, and then emulsifying the lens piece. So you can see this is a very systematic approach to lens disassembly, breaking up each piece little by little, using mechanical fracturing forces, essentially using the chopper and the fingertip both as chopping instruments. That's why it's called double chop, to crush the lens pieces into smaller and smaller pieces. By utilizing mechanical fracturing forces, you're not having to rely on high vacuum or ultrasonic energy to disassemble the lens. In my opinion, this is just really a very safe way and methodical way to be able to disassemble the lens, because sometimes you have to get close to the posterior capsule. And with this technique, you can get the instruments near the capsule, but it's not going to cause a problem because you're not going to accidentally aspirate the capsule or use ultrasonic energy to break the capsule. You're just using your two instruments to very carefully break up the lens. And so the chances of you breaking the capsule doing these maneuvers is very, very low. And that's why it really just gives me a lot of confidence to maneuver these instruments in the bag, even though I'm closer to the capsule, but I'm able to confidently manipulate the lens pieces and crush the lens pieces into smaller and smaller pieces, pull pieces up out of the bag, and emulsify the lens pieces. So you can see I was able to carefully break up those remaining pieces, and now that was the final fragment there. I'm removing the epinuclear material now. I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. Just making sure my sleeve is close to the tip. Start sub-incisionally removing the cortical material from anterior to posterior. It's just a very thin layer of cortex here. Not all the way around even, just a small amount. Going underneath the rexus edge, just using foot pedal control to control the vacuum, making sure I don't go too aggressive with the vacuum here. Again, with these very dense lenses, I always worry about weaker zonules, so you don't want to use really high vacuum if possible. Switch to the polish mode, and I'm more aggressively polishing blindly underneath the iris edge here. As I'm polishing the posterior capsule surface, you can see there's quite a bit of posterior capsule fibrosis, which again is usually associated with these very dense lenses. So now I'm going to go in with the BSS cannula and try to pulse in the sub-incisional capsular fornix, and you can see it does actually liberate a little bit of that cortical material that's there. So I'm injecting some cohesive viscoelastic to fill the capsular bag. I'm going to polish with the capsule sweep on the left side and then on the right side. I'm going to use this diamond blade to widen my incision. Again, I'm using a 2.4 millimeter incision, and with the 3-piece lens, you do have to widen it a little bit. So I'm going to widen the incision for the 3-piece acrylic lens. It's a little bit of a tight fit. Finally get it in with the bevel pointed towards the left. Before doing that, because quite a bit of viscoelastic came out of the eye, because I had to apply quite a bit of pressure, it's always a good idea to fill the bag with more viscoelastic before you deliver the lens. So that's another tip. When the viscoelastic comes out, just push more viscoelastic through the paracentesis and then advance the lens. So the leading haptic is in the bag. The optic has come out planar because I rotated the barrel of the injector counterclockwise a little bit, and then I use the multimeter to dial the trailing haptic into the capsular bag. So I go in with irrigation off, activate irrigation, go underneath the optic with the INA handpiece, removing the viscoelastic from within the bag. I go into polish mode and polish underneath the rexus edge a little bit, and then switch to visco mode, removing the viscoelastic from the anterior chamber. Pushing with the BSS to pulse the angle, and then I'll hydrate my incisions. You can see there's quite a bit of posterior capsule fibrosis. This was, again, a Catarock. You saw that double chop and cross chop were quite effective in breaking up this lens. There were some deep posterior adhesions, which required quite a bit of separation using the 2 instruments to separate the lens pieces, but with patience and enough effort, the lens pieces were able to be separated, and I was able to carefully attack each quadrant one by one, breaking up each quadrant into smaller and smaller pieces using mechanical fracturing forces and double chop and cross chop. So I hope this was helpful to you, and I thank you for your attention.